Hello and welcome to this edition of EC3 HOSA Medical Moments. Today we are talking about vaccines and the flu season and a little bit of COVID and pneumonia and just a little bit of everything. But joining us is Gary Ham, who owns the Apothecary Pharmacies in Elizabethtown and surrounding areas. And he's also one of our sponsors for EC3 HOSA Medical Moments. So Gary, thank you for joining us today.
Well, thanks for having me.
We are socially distanced and we're not yelling at each other or anything like that. So we're going to remove our masks so we can be able to be heard a little bit better. But we want to make sure that people know that wearing a mask is still extremely important. Proper sanitation of your hands and washing your hands and using sanitizer and sanitizing areas are still important.
Yes,
and not only important for COVID, but also for the flu as well.
Yeah, we could kind of start a little bit with that and mention that with the flu vaccine being out right now and everyone wanting to get their flu vaccination, a lot of people are concerned about social distancing and COVID and all that. So the pharmacies are using COVID standards for administering vaccine. The CDC has put its seal of approval on us giving them, because you're going to have to give it in person, correct? So some of the things we were already doing, like wearing gloves, sanitizing everything. In addition, they're going to have us wearing a mask, in some instances a face shield, and just being a little bit extra cautious. We do some off-site vaccination clinics, and when we go in there, we do things like sanitize the tables the area we're using, even though they've probably already done it. We also put tape on the floor to remind people to social distance, and we change our gloves, wear a mask, and all that kind of stuff, just for that added protection. The other thing is some people are kind of afraid to come in. Most of our stores have a private vaccination room.
Oh, good.
In addition, we're doing curbside vaccines. That's kind of a little different. So we can come out to your car, or you can come up to the drive-through. Some of our stores, you can come up to the drive-through and we can just walk right out. So there's no reason that should not be a reason not to get the flu vaccine.
Right.
And in some cases, we'll even come to people's homes. For some of those seniors that are afraid to get out, if they absolutely don't want to get out, a lot of times we can come to their home.
Oh, well, that's a wonderful service.
Yes.
For those that may not know, tell us a little bit about Apothecary and how you got started.
Well, Apothecary Pharmacy started in 1998. We've been in business, what would that be, 22 years, and in February it'll be 23. Mm-hmm. And it was kind of one of those situations where it was kind of like the reluctant entrepreneur. I had worked for several companies, hospital chains, mass merchandisers, grocery store pharmacies, and the last retailer I worked for, I won't mention, it was a chain. I just didn't like the direction they were going with the profession. I wanted to get into a more professional side. For example, giving flu shots or immunizations. We were the first pharmacy in Hardin County that was certified to give flu vaccinations.
Wow. And
I went to the first class that UK gave. Not that we didn't know how to do it, but they made us get recertified and take a refresher class in 2003. And it's really amazed me. We started out with just flu vaccines, and I thought, well, we'll do a few. It'll give pharmacy a more professional image, and it'll help the community out. Well, last year, pharmacists gave more immunizations than doctors or anyone else. That's amazing.
That's awesome.
Yeah. And now we give everything. We give everything from flu vaccines to shingles, which is called, the vaccine for that is called Shingrix. Pneumonia, we're giving travel vaccines to some people. Mm-hmm. We've also expanded to include HPV. Mm-hmm. So pretty much any vaccine out there that's available, we can give if someone wants it.
Flu vaccine. Explain it and tell us how they determine which one to go with every year.
So the flu vaccine this year is quadrivalent. which means it has 4 different strands.
Okay.
It has a couple of A's and a couple of B's, and one of those is H1N1. Believe it or not, the swine flu vaccine is in it, and the swine flu, which everyone forgot about from years ago, you know, now that COVID's come out and you mentioned swine flu, a lot of people go, swine flu, what is that? But yeah, so it covers you really well, and it's a challenge to determine what to put in the vaccine, which strands each year. So they start in the Far East. That's why you see like the Hong Kong flu or different ones like that. They kind of see what's going on there, and it seems like studies have shown it kind of spreads around the world from there. Last year's vaccine was only 39% effective. So a lot of people may use that as an excuse not to get vaccinated. But the other statistic there they don't realize is 80% of the people that died had not got vaccinated. Mm-hmm. So the odds are still with you. Mm-hmm. And a lot of people will get a list. I've heard several doctors tell patients that, well, you would have had a lot more severe case if you wouldn't have become vaccinated. So last year, it's kind of hard to believe, but in just the United States, 740,000 people were hospitalized and there were 62,000 deaths.
Wow.
So it's kind of hard to believe, really.
Yeah, really. Yeah. Right. With vaccines being so available, too.
Yes.
Yeah. Who should be vaccinated? Everybody?
This year...
for the flu.
For the flu, this year, the CDC is recommending everyone. They want 100% vaccination rate. Now, that said, it's children 6 months and older. So everyone, that pretty much includes everyone. Children will, pregnant women are one of the high-risk groups, and because of changes in the body and their immune system when they're pregnant, and women pass on some of their immunity to the newborn. Mm-hmm. So they're not only kind of like vaccinating themselves, they're vaccinating the newborn. So and that's why they go with 6 months and older. We've, of course, already started giving vaccinations and had several flu clinics, and we are seeing a lot of people that have never got the flu vaccine before or haven't gotten it in several years. So I think people are kind of listening. Right. And one of the reasons they want that this year is because of COVID. The COVID has kind of like overwhelmed our healthcare systems, although I think the system did remarkably well. However, they're saying if we had an upturn in COVID cases and we had a flu outbreak, could the system handle it well? The other thing is, if you're in one of those high-risk groups, would be diabetes, heart conditions, I'm trying to remember these, pregnancy.
Probably high blood pressure.
Yeah, HIV patients. And if you were to get the flu and COVID, that would probably not be good. Yeah.
Some people may feel like, maybe they feel it's dangerous. I mean, do you get those questions, that taking the flu vaccine?
Two of the most common reasons people don't get, or maybe I should just say some of the common reasons people don't get it are, one, they think it'll give them the flu. And like one of my physician friends says, it's like, well, if someone thinks it gives them the flu, or they thought it gave them the flu, they've never had the real flu. Because that brings me to my next category, is people afraid of needles. Those people are, once they get the flu, they're first in line. So the fear of needles is not as bad as the flu. And I will say, in our case, our company, we use an American-made needle. It's very sharp. We have people all the time say, did you just give me my shot? Mm-hmm. I mean, it has improved vastly. They're afraid they're going to have a severe reaction. Most of the flu vaccine that we use is in pre-filled syringes, and it's preservative-free. So you eliminate any of the preservative allergies like thimerosal, which is a mercury derivative that some people are allergic to. So you kind of eliminate that risk. But like I said earlier, we've been giving immunization since 2003, and knock on wood, we have not had one serious reaction or hospitalization from the flu vaccine. And I've given, personally myself, I've given thousands of shots, thousands and thousands. Mm-hmm. And the most common side effect is a little pain, obviously at the injection site, or redness. I know in my case, maybe 1 out of 10 years, I'll have a little bit of pain in my arm, but most years, the next day, I feel fine. I can't even tell I've had it. Mm-hmm. So.
And most health plans cover the flu vaccine pretty easily, right, in terms of cost?
Yes, that's one advancement, I guess, and it may have been a part of the Affordable Care Act, but it's preventive medicine they always talked about it, but now they're taking away the copays. Like, you're not supposed to have a copay on birth control pills. Well, with vaccines, there's rarely ever a charge. It's totally covered to the patient. Now, that said, if you're uninsured, there would still be a charge, but we charge the Medicare price if they're uninsured, so they get the best price. However, if you have any type of insurance, there is no charge to the patient. You'll see a lot of the pharmacies have on their billboard or their sign that it says, flu shots free with insurance. So.
Besides the flu vaccine, what else are individuals getting this time of year?
Well, it's kind of funny. The flu vaccine, when people come in for that, it just kind of reminds them that, hey, there's a lot of vaccines I need to get, and we have a whole menu of them, so to speak, on our form. But mm-hmm. most of the ones we give this time of year are the flu vaccine, and then second would be the pneumonias, and then third would be the new shingles vaccine, which is Shingrix. We had a clinic this morning, and I gave like 10. Mm-hmm. It really surprised me, and people were asking about it. They have a lot of questions.
Is that because there are more cases of shingles, or are we just realizing, oh, I think I had shingles back then?
I think more people are becoming aware of it, and just from personal experiences, the most people that are the most interested in it have had a family member or have had it themselves, or their doctors told them to get it. There's 2 shingles vaccines. Zostavax came out, over 10 years ago, and it was a subcutaneous shot, and it did real well, and that's the one actually I had, and it seems to have protected me. But the new one is called Shingrix. It's a 2-shot series, and you get 1 shot, and then after an initial shot, you get another one between 2 and 6 months. And it's touted to be almost 100% effective. Mm-hmm. And it's used some of the newer technology. It's a recombinant DNA type vaccine, which is super pure. I mean, it's just no byproducts at all. Like, they're not using eggs or anything to make it. They're making it basically in a laboratory with DNA. Yeah. Another vaccine that we give a lot of that we've had a lot of interest in this year is Tdap, which is mainly for pertussis. Mm-hmm. And then we've got measles. Not a lot of interest in that, but there's, I think, around the age of 50, if you were like between, I think, 55, around that area, which is when I was born, if you're born in 55, the vaccine around in that area was, the immunity has worn off, and they recommend a booster. Of course, we had the hepatitis A outbreak last year. Not as much interest in that this year. I think everybody already got it last year, the vaccine, that is. And I'm just trying to think. Let's see. I think that's the main one. So. Is
there a scare of not having enough flu vaccines?
The psychology of people, it's kind of strange. About 5 years ago, we had a shortage of the vaccine. Right. Everybody wanted it seemed to me. Right. The last few years, we've had more people. There's been ample supply. In fact, we had quite a bit left over last year. And a lot of people said, nah, I don't ever get the flu vaccine. So step forward to this year, we've had a lot of first-time vaccinators, and we had someone today said, I hadn't gotten it since I was like 10 years ago, but I think I need to get it this year, right, which is a good thing. As far as the supply, the CDC really doesn't recommends having the flu vaccine by the end of this month, by the end of October. Now, some of the chains, I'll put it that way, some of the mass merchandisers and chains have tried to jump the gun, in my opinion, and started in like, we have a flu vaccine in July. I think that's way too early. Right now, there seems to be ample supply. I say that. High dose, we have a waiting list, but the quadrivalent vaccine we have plenty of, which is what everyone gets up to age 65, and we can discuss that in a minute here and kind of explain the difference. But what really happens is they really can't have all of it ready just to ship out on a certain date. So it kind of comes staggered. So we're getting shipments each week. We're supposed to get, 3 stores are supposed to get a shipment of high dose today. Even though we have a waiting list, it's usually not very long. We've about caught up on it. I did hear one of the chains ran out of the regular vaccine, but everyone stepped up to have more vaccine this year because they do want to get as many people as vaccinated as possible. What's a little different about the vaccine this year is we've got all the vaccine this year is quadrivalent, which means there's 4 types, and then it used to just be 3 types. Okay. Last year they had both, 3 and trivalent and quadrivalent. This year it's all quadrivalent. There is a vaccine for mainly adults up to 65. Some manufacturers make a special pediatric vaccine, but not all. And the pediatric vaccines, there's 3 or 4 quadrivalents, and they each have a little bit dosings. Some of them are like a half dose. Others are still a full adult dose even for pediatrics. So just check with your pharmacist. Depending on their vaccine, they'll be able to tell you. And then there's the new high dose for people 65 and older. Now there's 2 vaccines for seniors. There's one called Fluzone High Dose, and they did an excellent job marketing because everybody wants the high dose now. Do you absolutely need the high dose? If I just turned 65, I've got a good immune system, I'm healthy, I don't have any risk factors, probably not, right? It's not like magically one day all of a sudden you need high dose. There again, it's the people with the risk factors probably should get that. But they say as we get older, and research shows, a lot of people's immunity response wears off. So the Fluzone High Dose is equivalent to 4 flu shots. It's got 4 times the vaccine. There's another one called Fluad, and it has an adjuvant in it, which basically takes the flu vaccine, makes it more bioavailable or work better in your body to produce a immune response. And they've both been proven to give the same immunity to a senior.
Awesome.
So there's 2 of those available.
Does pneumonia have anything to do with the flu?
Not really. However, pneumonia is right behind the flu in the number of hospitalizations and death every year. And that's probably why this time of year sparks the interest in getting that vaccine. It's been kind of confusing. The CDC changed their recommendations. Now, the CDC bases their recommendations on a couple of vaccine groups that make different, and sometimes those differ. But this year, the CDC came out and said you really don't need a pneumonia shot until after you're 65. Now, if you've already had one, we've kind of used 60 before that. Most people, if they've already had one, they're close to 65 anyway, and that's probably fine. It's just one of those. As more and more data comes out, it's kind of like with COVID. Sometimes more data comes out and they kind of change their recommendations. But
do you have people that come in and say, I want the COVID vaccine?
We have had people that they have asked when it's coming out.
Right.
Most of them know it's not out yet. However, or some of them jokingly say, is there COVID in this vaccine? I go, no, but the swine flu is. And of course they're working on it. But yes, we're getting a lot of questions. There's a lot of interest in it.
I think there's a lot of concern too, though, that if it being rushed, it may not be.
Yes.
maybe too much.
Well, there's a lot to be said for that, of course, and I would say that I'm just going to go with my recommendations and my opinion. My opinion is when it comes out, if you're in one of those high-risk groups, you probably ought to just go ahead and get it.
Right.
If you're scared, anybody else probably should get it, but if they're scared and they want to just wait and kind of see, maybe, and they're going to prioritize it when it comes out anyway. There's not going to be enough for everybody, so it's going to go to the military, I hear, and then the high-risk groups before they open it up to just everyone. I think our president has been a little optimistic on when it's going to come out, but he could be right. It could come out by the end of the year. There are 3 companies right now that are in phase 3, and I think those are Johnson & Johnson, Pfizer, and Moderna. Is that the name of the company? Anyway, there's 3 companies that are in phase 3, and we were talking earlier that Johnson & Johnson put a halt on their a pause. They called it a pause because they had a reaction. They've got to work their way through that before they continue. But
it is important that they follow the steps
yes.
of creating a vaccine.
Yes, there's 3 phases. There is a timeline. There are requirements. I don't think they're bypassing any of them. I think they're just putting it on the fast track and making it a priority to get it ready. And then, but to me, it's amazing they could get, because people were asking me in the spring, do you think we'll have a COVID vaccine? I said, there's no way we'll have it this year. I mean, there's just no way. Maybe by next flu season, but not this one. So we'll just have to wait and see which way it goes.
You had discussed on here, what are some of the new things in regards to the COVID concerns and the pandemic that you all are having to deal with?
Right now, one of the things that we're dealing with as a company are early on we were considered essential workers, and we needed to stay open to provide people with their medications, and they still allowed us to do certain vaccines. A little bit further into it, about a month or more into it, they wanted pharmacies to close their front ends. Yeah. And we did. Some of the big chains didn't, but we did. As a consequence, we haven't had any employees test positive with COVID. So I think whatever we're doing has worked. Mm-hmm. Some of the things that have been a challenge to us is getting employees to wear masks. Talking on the phone, we're on the phone all the time and talking to patients with a mask on. Keeping the store sanitized. Keeping up with the volume at the drive-thru. I thought we could never do it because we would probably do 50-50 of our business. People walk in. A lot of people just like to walk in and see the store and talk to people, right? Mm-hmm. And there's drive-thru people. There's people who like to come in. Then it went to 100% drive-thru or curbside. When we opened the front ends back up, the first month it was still over 90% still coming through the drive-thru. I would say right now maybe 80%, but I don't know. It seems like most people are still using the drive-thrus. Mm-hmm.
I was going to say that either way, it's important to get that information from the pharmacist and
yeah.
things in terms of that care and such.
Yeah.
What do you feel that for those individuals that say, well, I've never had the flu, or I've never had the vaccine, I'm a healthy person, as a responsible pharmacist, what do you think you need to say to kind of convince them?
Well, I would say, do you have not only responsibilities to yourself, but what about your family? Or do you have kids? Or do you have a mother? Would you want to bring it home from work and give it to them? The other thing is, I was meant to make this point, the flu and COVID had a lot of similar. They're both a virus. They're both, as far as they can tell, contagious by air droplets. So that's the purpose of wearing a mask and social distancing. When you're in your home, you're really close to each other. Mm-hmm. I'm sure most families don't wear a mask at home. Mm-hmm. Do they wash their hands and that type of thing, not sneeze on people? The big differences between the flu and COVID are COVID caused more severe breathing problems, and I'm hearing this from a lot of people that have had it, especially the teens and college age. They don't really get sick, but they lose their smell and taste for a few days. So that's some of the differences. But other than that, the fever and some of those other symptoms are very similar. So,
well, and even though
would you want to know if you had the COVID or flu? So if you had the flu vaccine, you might lean towards maybe I've got COVID, right? I mean, so I don't know.
Right. Well, it's always better. One of the things that we had discussed prior to this too is some of the changes that we're doing is just good practice.
Yeah, it's good practice even to prevent the flu.
Exactly,
Yeah.
exactly. What do you individuals you'd like them to know about the pharmacy and about the flu shots before we leave today?
I would just say the flu vaccine has been out for a long time. It's been proven safe. My own personal experience, like I said earlier, I've given thousands of them, never had a serious reaction. I think you're foolish not to get one. It's easily susceptible. I mean, it's easily accessible, and like you were saying, what are some of the other concerns? Not only your family, the community. You've heard of that herd immunity. If enough people in a community have the vaccine and immunity, you won't have that outbreak. I also wanted to clarify epidemic from a pandemic. So an epidemic, you would maybe have an epidemic in Hardin County of the flu. But a pandemic is usually large areas, and this one's worldwide.
Right. Right.
So
right.
We wonder if we have a flu pandemic.
Right.
On top of a COVID pandemic.
Exactly.
Is the worldwide health system going to be able to handle all that?
Right.
I will just say this, please get a flu shot, because since COVID started, I've never worked so hard in my life. A lot of people are been laid off or their businesses have closed, and I really feel for those people, especially the restaurants. But pharmacies have been right in there from day one. And
you all are definitely frontline people.
We have not stopped. We have never closed. We've been open. We've been taking care of people. The supply chain is good for medications as well as vaccines. And so do your part and get vaccinated.
Yeah, exactly.
Yeah.
Well, thank you, Gary, for joining us. And
thank you. Thanks for having me.
For those at home, again, if you have any questions, you can contact Apothecare Pharmacies. I'm assuming your websites are...
Yeah, we have a website, apothecarepharmacies.com. And we have a website. We have 5 locations. I can give you a card if you want to put the numbers up on the screen.
Well, we will definitely put those numbers up on the screen.
We're easy to get a hold of. The thing people like about pharmacies too, they call us and get to talk to someone. You're not getting a help desk. So
right. And you spend more time.
Our pharmacists should be able to give you, our pharmacists are updated and would be able to give you the latest information on vaccines.
Okay, great. Well, thank you again, Gary, for joining us. And thank you for joining us at home. And again, get your flu shot today. You can definitely get it. It's very accessible. Go out, get your flu shot, make yourself healthy for those that are around you.